and Criminal Justice program at St. Louis University. I also direct the 3+3 program. I've been in SLU more than 20 years. My research interests include systemic bias and violence against women. And so my background is a PhD in criminology, and I also have a law degree.
Great. Thanks, Dr. McGuire. And so the two new additions, Sini has a long history as well of working in the community, particularly with incarcerated, coming out of incarceration, support services, things like that. And so I think these are fantastic additions to our board, and it's going to make us even stronger going forward. So really excited to have those new board members on. So in that same vein, are there any comments or things that the existing board members wanted to either introduce yourselves or any questions for the director? Now, granted, he's been here like a couple of weeks, so I don't know if he's going to have a ton of answers. But maybe we should just go around and introduce ourselves for the new board members, so they can understand the composition of the board. And I'm just going to use my tiles here. So Dr. Heinrichs, would you mind going first? We can't hear you, Jim. Sorry. Yeah, sorry. Okay, we're going to move on, Jim. Nina.
Good morning, everybody. Welcome, Director Bess and Diane, to our board. I am an attorney and a mental health advocate, and before I was a forensic mental health specialist at Places for People. So my focus is really on rehabilitation, specifically mental health services and resources for those that are incarcerated at our jail. I really look forward to working with both of you, and a heartfelt welcome. Thank you so much.
Thanks, Nina. Dr. Heinrichs, we good? We still can't hear you, Jim. Not sure what's going on. Dr. McBride.
Thanks, and great to see you all virtually. And welcome to the board, Professor McGuire. My name's Tim McBride, and I've been on with Alex Garza, I guess, for the last two original board members. Is that right, Alex?
That's true, yeah.
So now that Jeff's left, so I've been on this board since it was reconstituted under Dr. Page when he was elected. And I'm a professor at the Brown School, and my main focus is public health, health policy, and I mostly do whatever Alex Garza says because he's brilliant. So
Come over and talk to my kids.
Oh, there you go. So maybe we could do that together. So, anyways, welcome to the board, and one quick thought of can I do a quick thought after the introductions? You may be dealing with that later in agenda item 6, but with two new board members coming on, and with the two members, Dr. Bishop Hankerson and Nina, it might be, I'm just thinking it might be good to have like a orientation to the board. I'm not sure if we completely did that as well as we should have with Nina and Bishop Hankerson. Now's a good time with our new director and new board members coming on to just sort of take a relook at what the board does and its relationship to the Justice Services Center. And so I think that might be, I'm just going to throw that out as an idea at some point.
Yes, I agree, Tim. And we will talk about that later on in the agenda.
Great, thanks.
Let me go back to Dr. Heinrichs. Jim, can we
any better?
Yes.
Excellent, thank you. Yeah, I'm Jim Heinrichs. I'm an infectious disease physician. I'm acting director of St. Louis County Department of Public Health, primarily while Dr. Cunningham, our full-time director, is on maternity leave, but she will return before your next meeting. So I assume she'll be here to welcome the new board members as well. But I'm excited to hear the tremendous qualifications of these two new board members. So really appreciate your service. Anything I can do to help, please let me know.
Thank you, Dr. Heinrichs. And then Bishop Hankerson, if you want to introduce yourself, I'm not sure about the connection or how much time you got, but please go ahead. And he must be out of contact. Okay.
This is Hankerson. Did you ask for me?
Yes, sir.
Okay. I don't know how well the signal is. I'm in Benin, West Africa right now. But if it gets spotty, just shoot me a text and say you can't hear me.
Absolutely.
This is Elijah Hankerson. I serve as local pastor with the Church of God in Christ. I'm also Bishop of our Missouri Midwest Diocese, overseeing 67 congregations in the area. And I serve on the general board of our denomination, 6.5 million member Church of God in Christ. And I've served on this board for probably 2 years now. And so congratulations to the new leadership and to the new board members. And
Okay. I think we
all
lost.
of you, I wish Dr. Bride talked about. Thank you all so much.
Thank you, Bishop, and safe travels. And I saw yes, totally understandable. Thank you for joining us from West Africa. And I saw on the chat that Senia is listening in, but I know that she's not going to be able to talk. And so welcome, Senia, and we'll get you. We'll make sure we carve out some time for you to do a proper introduction at our next meeting. Okay. Well, thank you all for introducing each other and welcome to our new board members. So now I'm going to turn it back over to Director Bess for an update on operations. So for this initial agenda, I included just a couple of items that we know we have been talking about for the last couple of months. And so, but certainly whatever else you have that you wanted to discuss with the board.
Well, with respect to general operations, that I don't have at this time. Obviously, just still trying to get adjusted within the Justice Services Department. With respect, however, to including the census and the federal contract. As to the census, I'm not going to just talk about the jail population. I just want to at least let the board know when I look at that word census, jail population, probation, and pretrial all consist of the Justice Services Department. So I'll provide you data on each one of those. So with respect to the jail population to date, we're at 1,157. Again, that can obviously fluctuate with ins and outs throughout the day. We presently have on probation 2,155 persons under supervision, specifically with respect to probation, and 297 with respect to those on pretrial services. And then the current number of the global positioning, the GPS system, is at 44. With respect to the federal contract, we are going back to the well, so to speak, on the federal contract. We have asked, we've advised the U.S. Marshal Service that we will reapply and provide them with up-to-date 2023 numbers. The initial amount that they were providing to us was not accepted. So as a result, we said we want to take a look at this by providing them with more up-to-date information based on 2023 as opposed to 2022 data, and then let them analyze the 2023 data to see if we can get an increase from what they initially have recommended.
Okay, great. So I'm just doing some quick math here for the total population that you described, and it seems like it's around 3,500. Does that sound about right?
Let me add it up.
No, but I think I really appreciate you looking at it as an entire picture, because you are right. It flexes up and down depending upon which bucket those people are in. And so I think that's really informative to look at it from a more holistic point of view. So I appreciate you bring those different categories to the conversation. So as far as the Justice Center goes, it seems like the census is still fairly high for from our historical numbers.
It is definitely high from the time of when I was named, and nominated for sure. I think when I was nominated, we were around 700 to 800, somewhere between there, is what I recall. So it has definitely increased. So the good news is we are having those conversations on how we can, get that population down, and hopefully at some point take a look at utilizing our pretrial services.
Okay, great. Any questions for Director Bess from the board?
Yeah, if I could, Dr. Garza, I think you already talked about it, and I do appreciate the more holistic view. But the census of 1,157 or so is quite high, and you're right. It was 758 or so is what I see, and at the end of 2020, or I get it, it's 20 at the end of 2022. So we're quite a bit higher. So my part of my question is, my memory of this is our capacity is maybe around 1,200, something like that, or 1,300. Is that right? And then when we get into the dashboard, the issues around the stresses this might cause in terms of staff and other issues is what always makes me sort of think through this. I think you're right, Director Bess, to sort of think about ways that this spigot could be slowed down or dealt with. And I was wondering if who you've talked to on the council or the executive about all this.
Well, right now, I've talked to members of the council, but we've talked about it in general terms, not specifics in terms of how to resolve it. Again, we're starting to have in-house conversations here, myself with the deputy directors, and in fact, we'll have our first discussion as a full official meeting on Monday to kind of discuss more things as well. But I think they all have an idea of where I'm headed with respect to taking a look at this population, not just for the short term, but for the long term. Reintegrating more alternatives to incarceration within our business operations. So to me, I think just about everyone in terms of those that joined me on the administration side, as well as in my brief conversations with a few of the council members, again, talking in general, that they are aware this is definitely high on our list, and it's something that we want to address. I have met with there's a committee that the Honorable Judge Ott has that I know Deputy Director Haywood attends on, I think it's a weekly basis.
Yes.
And I have met with her as well. So she is well aware that I do want to take a look at how we can maximize pretrial services. And one of the things that I'll say this, that I've talked about is a reimagining pretrial services. And that really is going to involve taking a look at everything from inside and out with respect to that area of the Justice Services Department, and see how we can try to make some changes where needed and be able to represent that to the court so that the court can feel comfortable in their release decisions for folks to be on pretrial services as well. So I would say in your earlier comment, though, I believe, and I'll ask the deputy directors to help me with this, but I believe the maximum capacity is under 1,300. It's 12 something, but it's not at 1,200, but I think it's just under 1,300. I thought it was like 1,280 or
Yeah. Yeah, something at 1280, so 87, somewhere around there.
Okay, so regardless, it's still high, and we still want to address it. But just wanted to bring that up.
Yeah, if I could just follow up real quick, and then I'll cede the floor, Dr. Garza. You know, as we move forward on this discussion, I think one of the important roles the board has played, just this is my observation, in conjunction with the directors and the entire Justice Services staff, is sort of providing a picture to the county executive and to the council about kind of what the story is, you know, and you know what's behind these numbers. And I heard a lot of that in what Director Best was just saying, and I think that's really helped the council make some key decisions. And one of the things, you know, I feel good about what we've done is to work well with the council, for example, to help get more officers hired, because this stress would be a lot worse if it weren't for that. So I think, you know, just sort of getting them to understand some of the points that Director Best just said. We've had some great analysis. I'll call out Aaron again for his dashboards. And we've had some recent discussions about what might be causing this increase in bookings related to guns and so on. I just sort of think telling the story to the council so that they, in the county executive, so they know what's going on, really helps. That dialogue is one of the big victories I think we've had in the last few years.
Absolutely. Thanks, Tim. Any other questions from board members on operations? Okay, great. Thank you. All right, moving on to the next item on our agenda. So, Tim, as you had brought up discussion on our interests and focus for 2024, I do think that it's a good time to sort of have a refresh on what the board is about, what its responsibilities are, as well as a general orientation to justice services as well. So, as Dr. McBride was mentioning, when we came onto the board originally, we had a session where we were introduced to how justice services works and the different components in it, and Sunshine Law and all of those different things. And so I think now with an almost complete turnover of the board, but certainly with leadership changes and things like that, that it'd be a good opportunity to do that reorientation. And so let's look for a good date when we can have maximum participation. I would prefer for it to be in person rather than virtual. If we can make that happen, I think you lose a little something being virtual, and I think it's important for the board to actually meet the administration and the different people that do this work day in and day out. So if it's okay with you, and I'll talk with the counselors on how we can arrange this to make sure we're staying above board with everything. We can look for some dates in the upcoming months to make that happen. Any thoughts or comments about that? I'm seeing a lot of shaking heads. Yes, so I'm assuming we're all okay with that. All right.
Yes, absolutely.
Okay. Thank you, Tim. All right, so we'll work to get that onto the board,
Sounds great. I'm commenting in the comments section because the signal is bad, but sounds great.
Good. All right, thank you, Bishop. Okay, that was really the few things that I wanted to cover in our interest and focus. I know with our new board members, we'll want to get together and talk about, you know, what are some of the things that we would like to be working on in 2024. So we'll get together on that. Okay. Anything else that board members wanted to bring up regarding our functions and our responsibilities? Okay, great. Let's go ahead and move over to the dashboard. Aaron, I'm going to turn it over to you.
All right, I'll share my screen. Okay, so a few things that I wanted to mention for this month. First is that Director Best mentioned the population as of today, I think, was 1157. You'll notice on the dashboard that it says 1112 for today, this morning, the 23rd. Those are both correct. Director Bess's number is the total number of people in the building, whereas the number on daily population, our historical day-to-day data, only includes the people in the jail cells. It does not include people in intake and people who are kind of like on their way in or on their way out. So don't be alarmed. That's not a discrepancy. Those numbers are both right. It just depends what you're counting. Secondly, I wanted to note, and this kind of backs up what we had talked about either last month or the month before about the causes for the jail population increase. I wanted to note that if you look at the number of bookings in the past 8 months or so, they are not going up. In fact, they are lower than they were in May of 2023, June of 2023. We have now had 3 straight months with under 100 bookings, and yet our population continues to go up into the 1100s. So I think if you look at those two things together, it validates what we had talked about last month, which was that the population increase is not largely on the booking end, but rather on the, you know, the retention end and the angle of what happens when the residents are already here. All right. The other thing I wanted to mention on the main dashboard this month is we saw a really big increase in use of force in January 2024. I just received this data a couple days ago, and I don't know personally what the context is behind why this might be, but when we talked about it, I was encouraged to spur discussion, and I was told that maybe, you know, Randy or Nate or Director Bess might have more information or context on what was going on there. So I just wanted to open up for discussion with regards to that.
1 minute. Yeah, so with the use of force, we had a lot more in intake area because of people that's coming in, you know, having a lot of problem with drugs. I noticed that we had, I think, 2 incidents down there yesterday. 2 people came in and we had to rush them out to ER because of overdose. So that increased a lot, have a lot to do with intake area.
Additionally, we have an increasing population as we talked about previously. That means more crowding, less patients, people get on each other's nerves. And so the amount of incidences is expected to rise as our population increases. It's just part of managing a jail.
Sure. And even though this number here is standardized per 1,000 residents, it could increase disproportionately as the number of people goes up due to, as Randy mentioned, you know, issues with overcrowding and stress.
Right, so Aaron, my question would be, is that what we normally see when there is an increase in census, there is an increase in use of force?
You mean an increase in use of force per 1,000 residents?
Right.
Like,
The rate.
I don't know. I'd have to look to see if the rate of use of force goes up disproportionately to the number of the rate of increase. But this is a weird one for this month that it's really high. It doesn't usually bounce around that much.
Right. Yeah, there's going to be some variation from month to month.
Yeah.
I guess I was just more interested in a trend if we saw that consistently.
I don't know. I could go back and look.
Okay, great. What else do you have for us, Aaron?
I think that's all on the main dashboard.
Okay.
The only thing I wanted to mention on the supplemental dashboard is that, and I actually want to open this up for comment too, because I do not know what the how valid this data is. But when I collected the data on staffing this month from the central database that's provided to me by the county data team, I noticed that the number of open justice services positions for corrections officers had gone up from 22 to 41, but that it wasn't a function of the number of filled positions going down, but rather the number of total positions being up. It actually had said that the number of corrections officers was the same, but the number of open corrections officer positions was almost 20 higher. So I'm wondering if that speaks to an increase in the number of possible positions or billets for correctional officers that have come into the department. It's also possible that the data is just not correct.
The 2024 budget did call for an increase of 16 new
Perfect.
additional
Yep, that
officers
explains it.
on the budget last year.
Yep.
And we've been working to fill those, so that's,
Yep.
that's,
So I just wanted to reassure people that this increase in open corrections officer positions was not primarily due to a ton of people leaving, but rather an expansion of the total number of possible positions.
Okay,
As a corollary to that, that's why the ratio of corrections officers to residents didn't really change that much this month. So does anybody have any questions for me on either of the DJS dashboards?
Tim?
Yeah, I raised my hand. I don't know if you want us to raise our hand or just jump in, Dr. Garza. So related to your question, Dr. Garza, yeah, if you could, Aaron, leave it right there. That's perfect.
Yep.
Those two graphs on the right-hand side.
Population and use of force.
Yeah, the sort of census is on the top and the use
Right.
of force is on the bottom. So it kind of relates a little bit to your comment, Dr. Garza, and I was staring at this a bit while, multitasking here. As you can see, it's sort of has peaks and valleys. But it's probably, you can see this recent peak is probably, I think it's important to know that it was related to drugs as well, but you can see that there's a certain, I don't know if there's a cyclicality to it. The last time it peaked a bit was in February, or I don't know what month that is. That's, February of 2023. But that's probably got more to do with staffing than it does with time of the year, would be my guess, because
I'm gonna run a correlation right now between the population and the use of force per 1,000 residents, as Dr. Garza mentioned.
Yeah.
And it is, the correlation's basically 0.
There you go. Okay.
Yeah. Yeah, so it just bounces around.
Yeah.
Why don't you run it with between that and the staffing ratio, because that might be the.
Yeah.
Oh, I just closed the file. Sorry about that.
Oh, that's fine. Later on.
But yeah, it was virtually 0 for use of force.
Yeah.
Yeah.
Okay.
Great, thanks, Tim. Any other questions for Aaron on this dashboard? Okay, go ahead, Aaron.
Oh, sorry. Let's move to the medical dashboards, and I don't have a whole lot to add on these. Let me find it. There we go. I think the only thing that caught my eye on these was that we saw percentage of provider visits for mental health disorders go down about what looks to be about 6 percentage points over the past 2 months, and that tracks with the percentage of people in the jail with mental health disorders, which has actually gone down about 11 percentage points over the last 2 months. So I guess those are good things, but that's about the only substantial change that I noticed when I looked over the data for these medical dashboards.
The only thing I would say, Aaron, I think you're right that that's dropped, and maybe Dr. Garza could jump in on this too, but the last 3, 4, 5, 6, 7 months have shown an increase in provider visits for mental health. I mean,
this year, I do want to reiterate, I think we talked about this last time, this period between August 2022 and July 2023, these numbers are not actually as low as they look. This was the data glitch period.
Yeah.
Yeah. So I know we've talked about that before, but behind the scenes, we have talked a lot about how to fill in that data, but it's not that simple, unfortunately. So
Okay.
so you take those numbers with a grain of salt. That said, the numbers have been high the last 3 or 4 months, but in the last 2 months they've declined.
Right. Okay. That's my main point.
Could you pull that graph up really quickly again, Aaron?
Sure.
Thank you. I was just wanted to see what the bars represented. So
Yeah, mood, psych visits, and other. And as I just mentioned, it's a little frustrating, but we've tried to fill in this data gap here, but it's proved a little bit tricky.
sure. Just a really brief question, Aaron. Don't spend a ton of time on trying to answer this. So this is not incumbent upon availability of a mental health provider either, is it? So if somebody wants to see a mental health provider, but if one is not available, does it still get counted in here?
I have no idea.
Okay.
I'm sorry.
Okay.
Yeah.
No, you're fine. I'm just trying to understand the magnitude. That's
Yeah,
all.
my knowledge of the fields on the medical dashboards is relatively limited. I just make them technologically, but I'm always happy to have somebody on here to comment on that. It's always
Yeah.
good we can get
Dr.
more.
Garza? Yeah, this
Yes.
is Jim Heinrichs.
Yeah.
We have had some challenges over the last 6 months in our psychiatric staffing as well as our psychiatric nurse practitioner staffing. So that might be reflected in the number of mental health visits for sure. But the screening, I would think, should be fairly accurate.
Okay. Thanks, Jim.
You're welcome.
All right, I think that is all for me. If anybody does not have any more questions on the dashboards, I will turn it back to you.
Really quick, Aaron, could you pull up the percentage of persons with psych visit there? The clinic and infirmary? Sorry.
This?
Middle column. No, sorry. Right there. Yep.
Yeah, those numbers are higher in the
Right.
past few months.
Okay. Okay. Thanks, Aaron.
Yep.
If I could just feed into where your brain was going, Dr. Garza,
Yeah.
I think.
That's a scary place, Tim.
No. I'm sorry, Nina, you had your hand raised, but I'll just finish my thought. If that's okay. I'm wondering, I think the Justice Services Center might be, just show us symptoms of what's undergoing in the broader community. I wonder sometimes, is, the lack of mental health providers, behavioral health providers, maybe Nina's wanted to comment on that. And if they come in struggling with that, as we heard from Director Best, and I think we're seeing some stresses around those numbers.
Right. Nina? Oh, we can't hear you, Nina. I'm sorry.
Hi, I was wondering if the provider was defined as just a psychiatrist or nurse practitioner, if it also included clinical social workers.
Dr. Heinrichs?
That's a good question, and I don't know the answer to that. I think it's primarily nurse practitioners and psychiatry, but we do have a pretty active social work staff, so I can check into that.
Okay, thank you. Because it would be great if we could capture some data on clinical social worker contacts.
Yeah.
Thank you.
I would like to add to the clinical social worker situation. I know that we had a position open since August of last year, and we've been trying to fill that position and not able to do that. So,
Is it specifically for mental health evaluation or just social work, more broad?
it was specific to counsel, mental health evaluation, and then being part of the
Right.
the supervision.
Right. I'll just add my experience. So I'm an emergency physician, and when we would consult for mental health issues, it was typically a social worker that would come and do the evaluation, and then they would contact the psychiatrist and then make the decisions on treatment. So
Either licensed or certified social.
right. So okay, great. And then really briefly, Aaron, I'm sorry to keep picking on these tiles, but could you pull up the substance use disorder tile again? Okay. It looks like the non-opioid is really decreasing over the last 4 months. And maybe
those
that's
have been
just because
consistently
opioid has increased, but
1.7 to 1.8% range. Yeah.
it's interesting because that seems different than where we have been over the last couple of years.
Right. The composition of the bar is proportionally is very different than it was for the same total over here.
Right. That's interesting.
Higher proportion of the overall total being opioid related.
Right. And I'm sorry, does substance use disorder include alcohol, or is it everything outside of alcohol? Do we know?
I don't know. Sorry.
Okay.
The
No,
doctor
that's
might know.
Dr. Heinrichs, do you know if that's what's being captured here?
I do not. We're actively looking at really trying to refine our medical dashboard a little bit more so we have more context to pass on.
Yeah, I think it's more out of,
Yeah.
it's just interesting that caught my eye that
Yeah,
proportion.
no, I think that's a great comment.
Yeah.
When we do that, I will comment when we do that. There have been preliminary talks about making a new medical dashboard, and there are going to be probably a lot of fields on there that are new. It won't be stylistic updates. I know we still need to get this into Tableau, but there is probably going to be a lot of substantial updates.
Great. Okay, thank you, Aaron.
All right, thanks everyone.
Okay, thank you. All right. We were at the public comment.
We have none, we do not have interest.
Oh,
No
come on.
public.
I mean,
Other
Okay.
than, well, yeah.
thank you, Penny. Okay, so let's go ahead and set our next board meeting. We're typically on the fourth Friday of every month.
It would be March 22nd.
March 22nd. So, and I believe everybody now, including the new board members, should have those calendar invites. So a couple of the things that I wanted to discuss with the board as well. So one is meeting cadence. And so I'm trying to make sure that we're maximizing efficiency for everybody, including our administrative staff that has to pull all these reports together. So let's start thinking about, do we need to be meeting every month? Do we want to back that off? I think, Tim, if I remember correctly, when we first started in 2019, we said we wanted to meet every month just because there was a lot of issues that we needed to tackle. But I sort of remember, this is pre-COVID brain fog going on here, that we said, hey, let's start out meeting monthly, and then if things seem like they're going well, then we can start backing off. And so in addition to all of those other relooks at what we want to do, let's take a look at our meeting cadence time for everybody as well. Okay, so don't have to decide anything today, but let's make sure we bring that up at our next board meeting. And then just so everybody understands, we'll have a closed session for our next board meeting to discuss some legal advice. Okay, so just so everybody knows that'll be happening at our next board meeting. Okay. Anything from our board members before we close out?
The Garza era is off to a great, Garza Bess era is off to a great start.
All right, we'll get some t-shirts made.
Yeah. And thank you to all the staff for all their hard work, and welcome to the new board members. I'm really excited to have you on board. So.
Yep, absolutely. Director Bess, anything else you wanted to add?
No, I appreciate this opportunity, and I look forward to continued discussions. Thank you.
Okay. So let's go ahead and call for adjournment. I think we just need a motion, a second, and then a yay or nay.
I'll move, I guess, to adjourn.
Thank you, Dr. McBride. Can I get a
Second.
second? I got Nina for a second. All in favor, say aye.
Aye.
Aye. Any opposed? We're gonna go off the air anyway, so even if you're opposed. Okay. Motion passes. All right. Thanks, everybody. We'll see you next month. Have a good day.
Take care.
Yeah, bye.
Okay.